We sincerely appreciate each of you for coming out tonight. Most of you don't know me, so thank you for introducing me to your table. I'm the general manager of the Patriot radio station. My name's Ron Stone. Thank you. I want to thank you all for being here and for the support that you provide the Citizens Council for Health Freedom throughout the year. It is only with your support that the incredible work of this organization can be carried out. You are the most important asset of the organization. Without you, there's simply no Citizens Council for Health Freedom, so we're proud to honor you tonight for making the work of this organization possible. There's only one person we think of when we think of the voice of healthcare freedom. She is the host of a radio program called the Health Freedom Minute, which I'm proud to say now reaches more than 3 million people in 37 states. And I got to tell you, that program started 18 months ago, 2 years ago on one little radio station. I'm so proud of you for what you've done with that. She testifies in Minnesota and lobbies Congress on our behalf. She was sitting in the Supreme Court when the Obamacare decision was read. She has stood for and fought for our rights and freedom for 18 years and has been a true leader for Citizens Council for Health Freedom. The fight for health freedom is not just a Minnesota fight, it is on a national level. It gives me great pleasure to introduce the person leading that fight, our president of Citizens Council for Health Freedom, Ms. Twila Brase.
Well, good evening, and I'm so glad that you all could be here. And I just have to say that it was Ron who came to me as the Patriot Station who said, wouldn't you like to do something? And he initially said, you know, how about an hour? And I said, no, I don't think so. Too much time. And I said something really small, and he said, how about a minute? I said, perfect. And so really, it's Ron who really had the idea for this to happen, and I'm so pleased to be part of it. I was looking at our guest list yesterday, and I just was looking down the names, and I said, wow, this is a great group of people. You know, I just really appreciate everything that you do. I appreciate who you are. I appreciate that you support us and what we do, and when I call on you, you ask. You answer, you come. You know, it's just a wonderful thing from my perspective because for me, just being me, I couldn't really do anything. It's all really about you. So this night is all about you and appreciating who you are. I know that you know that we have a special speaker here, and that's our gift to you. But before we get to that part, I have a few things to say about what we do, about who we are. And I'm going to start with our board. Now, some of you know some of our board members and some of you don't, but I want to introduce them to you because they're a great group of people. So let me start with, well, you saw Ron. He was up here. He is our he's our newest board member as of a month ago, and we're really happy to have him on board. And so I want them to stand. So Ron, you already know, and he stood, but then Martin Kellogg, who is the co-founder of this organization and who is our chair. Martin, will you please stand? And then Maggie Kottman, who is our vice chair and the owner of her own business. And then Val Bertline, he is our treasurer and secretary. He works with nonprofits. And then Dr. Matt Anderson, a physician. And then Mike Beckman, he is a physical therapist who runs and owns his own physical therapy practice in Chaska, but he is out of state and not able to be with us tonight, but just thanks you in his absence for what you do. So I'd also like to acknowledge a few other people, like Sherry Efforts, who helped with the registration and and did all the design, and you'll see more design from her to come. In addition, I'd like to acknowledge our two event coordinators, Crystal Queering and Anita Olson, back there. They set the whole thing up and did such a great job. And finally, many of you have already met our great volunteers. A lot of them, and I don't know where you are in the audience, but if you're there, just stand up and be known. Any volunteers? Any of our volunteers? Okay, there we go. Okay, so you've now met our board members. Now I'm going to make one announcement before I go further. On November 15th, we are having our annual event. And this time, it's an annual fundraising event, and this time, it's a dinner. And I am pleased to announce to you that our very special guest for that night is Stephen Moore. Stephen Moore is a senior editor at the Wall Street Journal. He is founder of the Club for Growth, as well as founder for the Free Enterprise Fund. And he is going to come and talk to us 9 days after the election and tell us after the 2012 election, he's going to take the pulse of freedom. So what is the pulse of freedom after the 2012 election? And he will be a great person to talk about it because he has been so involved in getting conservative people elected into office. So I'm looking forward to it, and I hope that you'll all sign up, and I hope that I will see you in 2 months. So I wanted you to be the first to know since you are our donors. So let me just begin here by saying that I want you to know that when I think about you as our donors, our supporters, I think of you as the heart and soul of this organization. I probably know more and understand more than anybody else in this room exactly how important you are because I see directly the impact of what you do for Citizens Council for Health Freedom. That you are the heart and soul of this organization is evident to me in at least 2 distinct ways. First, Citizens Council for Health Freedom sells nothing except freedom. And the fact that you are willing to make the purchase with your time and with your dollars is why CCHF, our old one, why CCHF is still here after all these years in the bluest of blue states and with a legislature that is one of the most progressive around the country when it comes to health care. The fact that you are willing to be generous to this organization is why we have the Health Freedom Minute. It's why we have it on all of those stations in all of those states, and 3 million people able to hear the message that I bring in educating them. It's my greatest joy to educate them about what's really happening in healthcare, to give them just a minute once a day to tell them something they don't know. I saw a woman at an event not all that long ago, and I picked up my name tag, and she said, she goes, "You're Twila Brase?" And I said, "Yeah, I am." She goes, "Well, you have the minute." And I said, "Well, yes, I do." And I never miss asking this question because I truly don't know the answer. I said, "So what do you think of the minute? I mean, what does it mean to you?" Because I said, I just talk into a black box. I have no idea who's listening or what they're thinking or anything. And she said, "Well, every time I hear it, I think, oh, that's something I need to know. That's something I should know." And another guy that talked to me, he said that they were facts, retrievable facts that I provide for him to have debates and discussions. So these are, I talk into a black box. 3 million people listen. I don't know what they do all with it, but I do know that I like what I heard from those 2 people. So I want you to know that through your generosity, we have been able to impact policy in and outside of Minnesota. I've been able to go to Washington, D.C., as some of you know, bringing information that no one else is bringing and talking about things no one else is talking about. I've been able to ask them to do things that they've never been asked before, and that's what they tell me. The other thing I want you to know that is really a tangible fact to me for what a significant difference that you make is that we are only effective because of you. And I know that I'm the face of CCHF when I walk around, but the fact of the matter is I got you all walking back there behind me. And that's what I know, and that's what I feel. So you are effective not only because you use your dollars, but because you use your digits. Digits. For example, this past year, Sam, our intern, and I were the faces that the legislators saw, the voices they heard, but the only reason they listened is because you took action. And you took action, and when you did, they changed their votes, they changed their mind, they backed off on a bill, and it was all because you picked up the phone or you did an email. And I'd like to give you a specific example. And I know that I could talk to you about the fact of what has happened with stopping baby DNA and all the people that came to those hearings. Many of you were there. And I could talk to you about the fact that we have stopped the law in Minnesota regarding Obamacare's health insurance exchange. But instead what I want to do is to, for some of you, remind you, and for others, tell you a specific example. As some of you may recall, a Republican legislator pushed a bill despite our opposition this year. I had talked with him about it 3 times and testified against it twice. It's not like he didn't know. The language was vague enough to enable planning for the Obamacare exchange, and it had other very objectionable items in it. Nevertheless, he insisted on moving forward. So when I got a notice late in the afternoon that his bill had been scheduled for its final hearing before it went to the House floor for a vote, and that the hearing was at 8 o'clock in the morning, the next morning, I did what I had to do, which was I put out an alert to you. And you all responded in spades, and I heard about it. So suffice to say, legislators were inundated with email. In fact, after this legislator sat down at that hearing, sat at the testifying table, and admitted to the committee that yes, indeed, the language was kind of vague, and therefore he was tabling the bill, in other words, killing it, he started to leave. And then he turned back and he looked at all his colleagues sitting there as committee members, and he publicly apologized to them for their email inbox that morning. So that was all because of you. And when one of his staffers talked to me later, he said, well, you certainly do have a following. So tonight's event is all about you and our celebration of what you do to make all of this happen. And before I introduce our very special guest speaker, I want to give you a short update which highlights more specifically what we do because of your financial support. This is what we do when we're not asking you to act, when we're sitting in our office and you're having your busy lives at home, and all I'm going to talk about is what we've done in the last 10 days. So in the past 10 days, we've accomplished the following. At the request of a Tea Party group, we created a petition against the Obamacare health insurance exchange for Michigan. In addition, I contacted the Mississippi attorneys who will soon appeal one of the 2 Obamacare privacy lawsuits. I offered him information about privacy intrusions in the law and in the rules that he said he didn't know about and he thought might be useful. And that's, of course, what I was hoping. And just 2 days ago, we were asked to send information on Obamacare, health insurance exchanges, and Medicare to Florida for a Tea Party gathering next week. Last week, I was asked by a free market Mississippi think tank to help them stop Obama's health insurance exchange. They wanted model legislation, and they're seeking our advice and our analysis of the government's request for proposals to construct it. And yesterday, a former South Dakota legislator asked to meet with me to discuss strategies for stopping the health insurance exchange in her state. In addition, I'm delighted to say that we've been getting people from all over the country subscribing to the CCHF Health Freedom e-News. Just yesterday, we got subscribers from Mississippi, Illinois, Arkansas, and Pennsylvania. We also just created a one-page document showing 10 reasons why states should say no to the health insurance exchange. We plan to distribute it broadly, nationwide if possible, and you perhaps picked up a copy of it out at the display table. And we want to include it with our written testimony to Congress on the exchanges. There's only until the 26th to do that, and any of you are available to do that as well. And new tonight, you have the opportunity to take home a hot off the press CCHF document you can use to secure a pledge from your candidates regarding the Obamacare exchange. It asks them to commit to vote no on any health insurance exchange legislation if they are elected. When you get a signature or a refusal, send, fax, or email the form back to us, and the instructions are all on there. So here we provide you with an opportunity to act that will help us to move our agenda of freedom forward. Now, they may refuse, but that's okay. They are not likely to forget that they were asked. And in the midst of all this activity, plus Sherry's and my preparation for this evening, the weekly e-news was written and distributed by email, the Health Freedom Watch newsletter was prepared, and I was interviewed by radio stations in New Mexico and Connecticut. In addition, I wrote and recorded 10 Health Freedom Minutes for our radio program because next week I'll be speaking against the health insurance exchanges in a debate in South Dakota and for the Eagle Forum Council in Missouri. In fact, I'm the only speaker, says Phyllis Schlafly, that's even going to talk about health care. And there's going to be about 250 very active women down there who I hope to send to all 50 states to engage on the health insurance exchange issue. And finally, we're working on various angles to attack the health insurance exchange that Governor Dayton is moving forward here without any legislative authority. I can't tell you everything that we're doing, but I can tell you that tomorrow or Monday we will send out an action alert that you can use to tell them what you think about their new principles for the exchange. They're asking for public input, and we want to have them as inundated as those legislators. So I want to conclude by thanking you for three things. First, I want to thank you for your moral support. We get such nice emails and notes, oftentimes from our contributors, and I have a very special file where I keep them all. Second, I want to thank you for your active engagement, including volunteering for us, and for helping us stop bad bills and advance good ones. And finally, thank you for your continued financial support, without which we wouldn't exist or even be able to grow. And as you can see, we're growing in impact both in this state and around the country. And in the future, as funds permit, we want to increase our staff significantly, is my hope. So I know you've heard this, I know you've heard me say this before, and it is absolutely true. We do what we do only because of you. Without you, nothing would happen.